I want everybody to know, or if you watch this, if you listen to this, many of you do, chat message me your thoughts and response to my question. The 75 hard program is not what I want to do, but 75 hard, if you've not heard of it, is it's a 75-day challenge, kind of a health challenge where, for example, every single day you're supposed to do two workouts. Now, a workout can be a lot of things, can be weightlifting, can be walking, can be whatever you want. But for two 45-minute workouts per day, one of them has to be outside, one of them can be wherever. Then there's things like, you have to follow a certain nutrition plan. It's not specific to anything. You have to drink a certain amount of water every day. You have to read 10 pages of a book every day, et cetera, et cetera, et cetera. There's different stipulations. So I've always thought I wanted to come up with my own functional medicine health twist to that type of a thing. What I was thinking, because so many people tend to get caught up, and I'm not one of them, but some people are first of the year, right? Like January, New Year's resolutions, all that kind of stuff. So I just was going to throw it out there. I've thought about it, and it would not be as intense necessarily as the 75-day hard, but it'd be a great way, I think, for us as a community. And I would probably see if I would invite others. If you guys knew people, friends, family, coworkers that would want to take part in something like that with some support. I don't know, just a thought. And it might be 30 days, it might be 60 days, but I'm going to have different things in there that are more along the lines of a little bit more detailed in, like, say, nutrition, hydration, movement, and exercise isn't going to be quite as intense as 2 45 minutes, but like some specific things there, and some other things like I'm going to have, I was thinking like a stress challenge, stress management challenge, those kind of things. Would anybody be interested in that? I can only see Kristen.
Yes.
Kristen, yay, one person. Hey, shoot, if it's just me and you, why not? We'll just do it. Sometimes it doesn't even matter with. Did you need, are you saying no? I can't hear you. I don't know. You're still muted.
Okay,
There you go.
I'm saying no because you've got me on that already, and I am going
Well,
to be done.
well, not necessarily. This would be a little different. It would just kind of help keep accountability, because all of you guys that are in here, you're not the only one. Everybody's doing work, but it would help keep accountability. Because so, for example, those of you who, if there was outsiders coming in, it would be a whole thing for them. It would be a lot of great information for, like I said, friends, family, people that you know that might be interested. Now, for you guys, it would be more of a, it's easy to, with all the things that you're trying to do, for example, Janine, like with nutrition, supplementation, all that, it's easy to forget about or not have part of your routine. For example, something like relaxation work or mindfulness work or things like that. So again, and everybody's going to be different. So that's where I would have these different categories, just more of an accountability thing. Now, if you have no interest in it, believe me, no big deal. Not, it's just an idea that I thought I'd throw out there. So again, if you're listening or watching, shoot me a chat and I'll just keep talking about it, because it's only what, November 19th. So it would be sometime in January that I would probably like to do something like that. So anyway, just keep your ears open. And if nothing else, invite people. Once I get the details, we can just invite, like I said, it could be a great exposure, I think, for some people just that want, there's a lot of challenges out there. There's a lot of people who do a lot of things in health, in the health space. And I just think a lot of them are really not great. They can actually stress people out, stress their physical bodies. I've known a lot of people. 75 hard can be one of them, depending on the person. I've actually had some patients and known some other people that have done 75 hard, and it's been a disaster, just because it stresses them out physically, mentally, all the things. So you don't want that to have happen. The point would be to make some good progress in your health journey. So anyway, I'll leave that for now. It was just a thought I wanted to throw at you guys. But let's get to today. I decided to go deep deeper on a subject that over the last couple times, I think starting with the Q&A time we had a couple weeks ago, and then last week I know we talked about it a little bit. Um, it's another one of those subjects that, you know, here's what I want you guys to do. It applies to every single one of us. Number one, I think most of these topics do in some way. I want you to listen to kind of what I have to say today from a couple lenses. Number one, from your personal story. Okay. So some of us, I'm 42. Some of us are in our 50s, 60s, 70s, whatever, 80s. It doesn't even matter how old you are. Think about what the topic today from the lens of your personal story from the time you were born. Okay. And number two, the second lens, I want you to kind of listen and really take this information in is the people that you have in your life that need to hear this. Okay. Um, because I think the fact that everyone knows is chronic illness, chronic disease, the health of our generations now, our kids, teenagers, early young adults, it's a disaster. It's an absolute disaster. It's worse than it's ever been. And nobody can ever convince me that it's because we have better testing and earlier diagnosis and all these things. No, it's just not the case. It's like we didn't used to see the things that we're seeing now. Okay, so those are the two lenses I want you guys to think about as I go through this. So specifically, this is a talk. I kind of modified it a little bit, but I said this last week. This is a talk that I have done, oh my gosh, probably dozens of times over the years. Specifically back when I used to work more in physical medicine, chiropractic, functional neurology. I used to work with a lot of pediatrics for a number of years, a lot of kids with spectrum disorders, sensory processing, and just chronically sick kids. So that's kind of the subject is why is this happening? And we're going to take a little different route today, a little different perspective than maybe what you hear me talk about a lot, which is like, oh my gosh, we need to check our kids' gut health. We need to have clean living. All of those things apply, but that's not the focus today. It's going to be a little bit of a different twist on it, okay? So I'm not going to spend a lot of time when I give this talk, I talk about Ruby, or this is my 8-year-old daughter. We have an 11-year-old, and when their mom and I had our firstborn, we knew, so that was 12 years ago. We both are in healthcare, but I did not even know then what I know now. And I mean, but back then it was like, man, we knew we wanted to try to raise our kids to be obviously healthy, thriving kids and to not, we knew at that time, I grew up in kind of a traditional, medicine model, right? I mean, I didn't have to go to the doctor a lot, but like, that's just all we knew, all my parents knew. Um, so we knew we wanted to do it differently. We just didn't necessarily know all of the details. Okay. So anyway, we are navigating that through the first year or so of our oldest life. And then Ruby came along, our second. At our 20-week ultrasound, we knew something was up when the ultrasound tech was just like, I need to go get the doctor. That whole thing, like you're like, well, what the heck's going on? Well, so anyway, long story short is she was diagnosed in utero with some congenital heart defects and some other things. I'm not going to go into all the details, but she's a miracle. She's an absolute miracle. There's no question about it. This little video, oh my gosh, give me a thumbs up if you can hear the sound. No? Okay. That's because it's not necessarily this video, but I wanted you to be able to hear a different one. You know what? I'm not going to worry about it. I'm not going to play around with it too much. So this is Ruby after she was born. So the plan was we had her at St. Elizabeth's, and the plan was I was hopping in the ambulance, and we were going to drive together to Omaha for immediate open heart surgery. They were going to keep her alive on the way, obviously. And this is a video that I was holding her hand in the NICU at St. E's. They rushed her over there, got her hooked up to all the monitors, and And it was just a miracle. Like on the screen, all these doctors are gathered around the echocardiogram and all the things they're doing. And I remember vividly, you couldn't hear the sound, but the cardiothoracic specialist that we had worked with was like, what is going on? We don't see this happen. Her little body just like adapted and healed itself as she was growing in utero. And then obviously when she was born. So she has some interesting things going on. I wish I could sit here and explain everything that happened that day. But my point is really that man, we are designed to heal and to thrive, right? And so if we can give the opportunity to ourselves and our little ones, and you guys are going to see some data later. I've talked about Harvard and how Harvard's done a lot of studies in the developing child, and it's amazing stuff. And not all stories end like this. Obviously, I understand that. And we are blessed. We were lucky to have her. We have her as our little 8-year-old. That was me holding her hand when she was born. This is one of my favorite memories. Oh my gosh. Like I was her heart, so she had congenital heart defects and some other things going on. And I put on my stethoscope and I was listening to her little heartbeat. I mean, I don't even remember. I don't even, it was just all a blur. Like this was one of the coolest memories though, because she was thriving, never had to have open heart surgery, never had to have, there she is eating her blueberries. So the point is like we are capable of so much more than I think we even give ourselves credit for. Right. So there she is riding her horse Boomerang. She's the one in the pink. That's my oldest Raylan giving us the dirty look there. Graduating from kindergarten in 2022. Here's a lake day. We threw in another kid called Stetson. Apparently, we had a boy. This is actually Denise. This is in Wisconsin. There's a nice little Wisconsin lake for you. So the clear blue waters of the lakes. Hiking up we went up a 14,000-foot mountain, and my kids and I. It was an amazing trip. And then this was this year before school. So we are so resilient. And what I want you guys to know, again, from your story, but also anybody that you guys know, that man, their kids are struggling, or maybe you know someone who's pregnant and they just want the healthiest babies, right? Maybe some of you guys have teenagers right now. We're going to talk about teenagers and 20 somethings, but this, like I said, this applies to everybody. So we can either go a traditional medical route or a functional kind of medical route, which includes a lot of things, right? So I would put chiropractic care in there. I'd put physical therapy, like just a lot of things. Occupational therapy, pelvic floor therapy, all of that would be under kind of number two there. And of course, at times there's a requirement for both of these. Okay, so obviously both of these. We use traditional medicine with Ruby, right? Because we thought she was gonna have to have open heart surgery, and then oh my gosh, from there we didn't know what was gonna happen. We didn't. We she did not have a very good chance of surviving, and she's a thriving little 8-year-old. So miracle, miracle baby. So here's the one that I wish it had sound, but it's not going to be that big of a deal. So everybody watch the screen. Everybody pay attention. This is a test. We have a quiz here. So after this video's over, you guys are going to unmute or put it in the chat what your answer is. Okay, everybody clear? Watch the screen very carefully.
This is an awareness
It's an awareness test. I'll explain since you can't hear it.
How many passes?
How many passes did the team in white make? Okay, how many passes?
The answer is 13.
Dang it, I didn't pause it fast enough. Did you guys hear the answer? How many? It's on the screen. Did anybody get 13? Be honest.
I did
No.
not get 13.
It's probably a little choppy. I know my end, it's a little slow, but you didn't get through. Okay, so it's 13.
Wow.
Okay, did anybody get that? Some of you did, some of you
Half
didn't.
fast.
Okay. Anybody notice anything else?
No.
Okay. The
But
point of
there
this
are other
video
teams the ball.
is not the 13. Let's watch again.
But did you see the moonwalking?
But did you see the moonwalking bear?
No.
Rewind.
Jesus.
Okay, they start passing it. You guys see this guy right here?
Yeah.
It's a guy in a bear costume.
Oh, I couldn't
it's
tell what that
little.
was. Now I
It's too dark.
See him on the
Yeah.
left
Yeah.
side of the screen now?
It's too dark.
Hmm.
I thought it was
No.
just a bad hairstyle, to be honest. And some
Funny.
baggy clothes.
The point of this is, and I don't think anyone I've ever played this video for, if you guys have never seen this, I just think it's hilarious because it's easy to miss something you're not looking for.
Right.
Okay. Now, we're paying attention. We're so focused on the people in white and how many passes. We didn't see this dude in a bear costume dancing his way across the basketball court. Okay. So, what is the point in healthcare? Okay. In traditional medicine, I'm just going to say it. We are not looking for the right things so much of the time. Okay. And it starts from the day probably before a kid is born in utero, and then obviously from then on. Okay, so you guys, a lot of you guys that have been around know that. I talk about all of the gaps and the things that in traditional care we just are not looking for and talking about enough. Now, one of these is stress. Okay, so this isn't going to be new to a lot of you guys, but I've given you a diagram similar to this that I've made, kind of my version. But this is what's called the gas versus brake. Specifically, we use this in functional neurology in the chiropractic and the nervous system world. But basically, it's what you guys all probably already know. You have, whoops, you have this tachometer, right? So like think about the RPM dial on your vehicle from 0 to 10, right? When you're revving the engine, when that gas pedal is cranked to the floor, your RPMs go up in your vehicle, right? The same exact thing happens in your nervous system. When we are stressed out, when we're worried, when we're anxious, when we have all of these burdens on us, traumas, all of the things, okay? But you remember, it's not even just that. That's the category of thoughts or emotional stress. That RPM dial goes up. Then you add in the one in blue, which is toxins. So the chemical stresses of life, food, water, air we breathe, all of the stuff. That's going to take the RPM dial up. And then you have the green, which is more the physical stressors. I sit at a desk all day. I have poor posture. We're not meant to sit. Like, you have a bad knee, a bad shoulder, you have back pain, you have a disc herniation. All of these things amplify the stress response in our body. Okay. So think about that. Think about all the things in your life in these three categories that are going on. How high do you think your RPM dial is? Okay. Now, you guys know that that's called the sympathetic fight or flight response, the higher that is. We need that to live and to function, but it has to be balanced by the brake pedal, right? Just like when you drive a car. So the brake pedal is the parasympathetic nervous system. Okay. Now, if you look at the bottom of this poster diagram thing, look at the bottom. So specifically, now that you can apply some of this stuff to adults, of course, like headaches and back pain and inflammation and constipation and acid reflux and Crohn's, IBS, allergies, high cholesterol. You see all of those words in there, but look at some of the other words that specifically apply to pediatric care. Okay, the sensory issues, infertility in a lot of women is a stress response. Okay, behavioral issues. Okay, asthma, that more kids have asthma now than ever. More kids have chronic illness. More kids have ear infections that need antibiotics, right? Like all of these things. And I'm going to tell you right now, a lot of this, if not all of this, is preventable. Okay? In some way, shape, or form. So, is your stress stuck on? Is that gas pedal just like chronic pedal to the metal? Okay? Or in your kiddos, in your teenagers, is that happening? So again, the 3 T's is kind of the way I remember it, is the trauma, which is the physical stress, the thoughts, which is the emotional stress, and the toxins, which is the chemical stress. Okay, so even if it's like some people will say, well, my baby it doesn't have, emotional stress. Well, even if that's true, how much physical and toxic stress, even just the toxic stress, even that alone can be crazy, right? But I would beg to differ that even a newborn baby can have emotional stress, okay? Because if they're in a toxic environment, if their parents are yelling and screaming and fighting and arguing, and believe me, we know that this affects a young one's nervous system. Okay, so as parents, of course, that's our job to mitigate that and manage that. Okay, and get out of toxic environments for the health of our kiddos. But so this is Dr. Tony Ebel coined this, the perfect storm. So we're going to talk and dive in a little deeper today as far as we get. This will probably be a two-part series. What is this series or sequence of stressors that lead to so much sickness, illness, chronic issues in us? Because if, like I said, look at it through the lens of what's your story and how many of these things apply to you and your story, and then you can think about kids in your life too, grandkids, your children, etc. Number one, significant mental and emotional stress during the prenatal period. So we know that even before a woman becomes pregnant, right, if there's a lot of stress, those 3 T's going on in her life, clinically documented in over 60% of cases, that there was then issues with the baby, right? The baby's born into this fight or flight environment in their body because even prenatal and during pregnancy stress. The umbilical cord is the power cord to a baby. So if a mom is really stressed out, that is literally can become hardwired into a baby's nervous system. We know this. Now, this does not get men off the hook, okay? Because, the reason I said this was our story, this was Ruby's story, is there's no way for us to say 100% why all that happened with her. But Brittany, Ruby's mom, was in a very stressful time in her life as we were trying to conceive. She actually had just opened her own practice. And you guys, anybody who's a business owner knows, I mean, that just is a stressful period of time. I did not help. And I fully admit that because I had a private practice with a business partner. We were having some struggles. And I was just working all the time. We had a really amazing clinic, but I was burnt out. This was kind of part of my story, why I do what I do now. I've told you guys, I was burnt out, I was stressed out, and I brought that home. Okay. Did my stress impact her? Yes. Did it impact Ruby? Yes, absolutely it did. Okay. So this is why I preach and preach and preach and preach about everything you can do to mitigate or dampen emotional stressors in your life. Okay. Number 2, medical intervention at labor and delivery. So if it's part of your story, if it's part of your children's story, if you had to be induced, okay, yes, induction, like Pitocin, okay, yes, epidurals. And some people would debate this and probably get really, really maybe triggered by this. But what we know via the science and research is these things impact labor and delivery in such a way Pitocin is a medication. It goes into the baby. Epidurals tend to slow down pregnancy, slows down the contractions of the uterus, so it can make a more stressful environment for the baby. Of course, C-sections, we're going to talk specifically about that in a while, but forceps, if a baby's stuck and they have to use forceps, they have to use vacuum extraction, all of these things are huge stressors to a baby, to a mom for sure, but also to the baby. Okay, so this is clinically documented in over 85% of cases. This is the moonwalking bear stuff, guys. Okay, so when I say clinically documented in 60%, number one, and 85%, I'm talking about kids that are chronically ill or have some sort of a sensory processing spectrum disorder. Like literally, the statistics aren't irrelevant. 85% of these documented cases, something like this was part of the story. Okay, so take that for what it is. If a baby, number 3, is stressed out. Okay, so if they're born into this fight or flight, this sympathetic gas pedal stuck on in the baby, it's been hardwired in because of whatever's happened. Number one, number two, maybe both. Okay, these are the babies that are colicky, that don't sleep well, that are constantly crying, that are constipated, because that should make sense to you guys now, right? Right? Like sympathetic,
Mm.
you cannot be in fight or flight, rest, digest, grow, heal at the same time. They have to balance each other out, and we need a balance. But if they're like this, fight or flight, they're colicky, they're constipated, they're fussy, right? These are these kiddos, okay? You can't soothe them. You can't calm them down. Now, what it says there under that bullet point is then what? Okay, so you get through the baby stages. Here is one of the things that drove me more nuts than anything probably when it came to pediatric care is, and again, there's amazing pediatricians out there, guys. I never want you guys to think that I'm like bashing medicine, but this is the reality. How many times I had parents come into my office and say, well, our pediatrician evaluated my colicky, constipated, blah, blah, blah baby, and they said they're just going to grow out of it. Ticks me off because this baby's trying to tell us something. Something is not right. They don't grow out of it. If you look at the data of these kids, you follow them, they turn into the kids, the toddlers with ear infections and asthma and allergies up the wazoo and can't eat food because they're constantly, have allergic reactions. They're the fifth graders who have anxiety and who eventually get diagnosed with ADHD or sensory processing disorders. So did they grow out of the colicky, kind of constipated, fussy baby stage, or is it just turning into things as they get older? Different things. Does that make sense to anybody? Okay, because their body, our little kids' bodies are resilient and they adapt and they compensate. And so different as these systems of the body, like if the immune system is compromised, okay, which it is in a fight or flight baby, stressed out baby that has colic and has, constipation and fussy, blah, 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 not sleeping well. Okay. The digestive system will eventually be the problem. Now, so the digestive system, right, is the immune system. So the immune system isn't working. Well, that's going to be then the gut-brain connection. The gut-brain connection, ADHD, anxiety, depression. You guys start to link all these things together, right? Like it starts to become very logical why so many kids are going down this exact pathway. Okay. Constipation is 4 times more common in children with autism than those without. It's just an interesting fact. Causation, correlation, but the thing is spectrum disorders and that autism is being on the kind of more severe end of that. Almost all of them have constipation and gut issues. I've never seen a kid that doesn't. So I'm 100% for me clinically, 100%. Okay. So something to think about. I don't know what that yellow line is in the middle. My goodness. Does anybody else see that? That's weird. Anyway, number 4, I digress. Sensory, constantly sick, challenging toddler. So I kind of already mentioned this. So these issues, this fight or flight mechanism, this stressed out nervous system, it clogs up the plumbing in the body. So the lymphatic system becomes sluggish, all the things you guys probably have heard me say a million times. You don't have adequate stomach acid, the gut bacteria gets off, blah, 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 blah. And this is when the challenges arise in toddlers like constant ear infections. I mean, tubes that are having to be put in ears, the allergies and the asthma. Like I said, asthma 2 to 4-fold studies show with antibiotic use. Okay, so the gut-brain connection, 100%, and the gut immune system connection. I've said this before. You've heard me say this. Knock on wood. I don't feel like I need to knock on wood, but sometimes I'm like, I need to knock on wood. 11-year-old, 8-year-old, and my son turns 6 in like 2 weeks, a week, something like that. Never one antibiotic. Not one. Never have we given them a dose of Tylenol, ibuprofen. Nothing. Okay, we are not special, especially given the story that you guys now know about my Ruby. Is she tends to get respiratory because some of the stuff with her heart had to do with her lungs too. She had some stuff going on with her lungs. So, she gets the crud that goes around in school, obviously. And she's of the three of them, she gets the most severe respiratory stuff, like the coughs and and even when it's gotten really bad, we treat it naturally. And she pulls out of it faster than most kids do. Okay. So it's possible. So if you know people who are stuck in this with their kiddos, and they're constantly turning to medicine and antibiotics and all of these things. Like I've said a million times, sometimes necessary and needed, but there's so many other cool things. So just for an example, ear infections. Our kids, anytime we ever saw them start to play with their ears, that's kind of usually what a toddler does. They start to like tug on their ears or itch their ears. Garlic mullein oil. Garlic mullein oil. You can get it anywhere. Like Red Clover Market, if you're in Lincoln, whatever, health food stores. We would lay them on their side. We'd put 3 to 4 drops in their ear. We'd make them lay there on their side for 5 to 10 minutes. Let that garlic mullein oil soak in. You guys, most of you probably know this. Those of you who have been in the program a lot of you are on garlic supplements or oil of oregano. You don't put oregano oil in your kids' ears, by the way. Garlic. What is garlic? It's an antimicrobial. It's an antibacterial. Natural. We never had an ear infection. I mean, I think that's amazing. I hope you guys think that's amazing. It's amazing. Okay, so there's so many cool things out there. Number 5, sensory spectrum hyperactive, emotionally stuck kids. So rates of autism have obviously, I think it's even more than that, like tripled, quadrupled, I don't even know, quintupled at this point. I think the number's down to like 1 in 35 kids now, with boys being a lot more likely. The rates of ADHD diagnosed in kids have soared 67% in the last 20 years. That's an old number too, from a number of years ago. It's more than that now. 3.5 million U.S. kids on ADHD medications. And it's like, medications, are they necessary? Are they needed? Or are they actually making things worse? Are they putting a Band-Aid on it? That's the question we need to be asking ourselves. Number 6, then we get into the teenage years. So, okay, the kid kind of is ticking off all these boxes. Now, I'm not saying every kid is going to have every one of these things. Okay, they might have number 2 and number 4, whatever. You guys get the point. But number 6, when they get to their teenage years, these are the kids that we most often see that are exhausted, that are stressed out, that are angry, that are anxious, that have behavioral issues, that have depression. Okay, and of course, then that can go into adulthood. Rates of anxiety in teens has already surpassed adults and reached 1 out of every 3. And then they rose again dramatically after the COVID-related lockdown. So, because social interaction is so crucial to health, right? So don't be a hermit. I know sometimes I want to be a hermit, but it's not healthy for us. Okay, we need a tribe of people. And number 7, burnout, stressed out, anxious, ADHD adults. I know that's a lot of us in this room. Okay. Anxiety disorders are still the most common mental illness in the U.S., affecting 40 million. This is an old number, more than that now, in 18% of the population every year. It's probably more like 25% now. Like, it just keeps going up. It just keeps going up. Okay. Does anybody have any questions so far? Because that was a lot in even just a few slides. Any questions? Okay. Question. What does stress do to you in your adult life? If you're really stressed out, you have just a stressful week, a stressful day, what happens? If anybody wants to answer, go ahead, or it can be rhetorical.
I get kind of crabby.
Crabby. Okay, so your emotions. Yep,
Yeah.
absolutely. Mental health,
Fatigue.
and that's all. Yep, great.
Mhm. Really tired.
Tired. Okay. Yeah, fatigue.
Stress headaches.
Headaches. Absolutely.
Can't sleep.
Can't sleep. Okay, it disrupts your circadian rhythm. Your nervous system is on the gas pedal. That makes sense. Why would you be able to sleep well? You can't rest. Does anybody get constipated or have diarrhea, like either one, like bowel issues? when they're really stressed out. Does anybody have stomach issues? Like, man, you get stomach or nausea. Has anybody ever experienced that where they get really stressed? I hear these kind of things all the time, right? All the
Yeah.
time. Like, oh, I get stressed and I get this tension headache and then I'm nauseous and blah. This isn't coincidence, y'all. Like these symptoms that so many of us struggle with, okay, is this sensory nervous system dysregulation. So irritability, you guys said almost all of these, I think. Irritability, sleep issues, migraines, tension, like get tight. We just get tight, right? Maybe we have more joint pain. That inflammation goes up. Digestive issues, of course, and then immune system. So nobody said that. Like when you get stressed out, is that when you get sick? Yeah, I know that's the
Yeah.
case for me. I hardly ever get sick. And even if I get like a cough from my kids or some crud, it's like, it's not severe at all. And my body works it out unless I'm really stressed out. If I'm in a really stressed out thing, it puts me down and out. That's the only time I've ever been down and out from an illness is I can directly say it was because stress in my life was high and I was not maybe mitigating it or treating myself like I should. So what do you think is, as an adult, who you guys as adults are more more resilient even a lot of times than our kids? That maybe seems backwards to some of you. Like, kids are so resilient, yes, but they're still developing. They do not have a fully functioning immune system. They do not have a fully functioning respiratory, lymphatic. Like, all of these systems are still maturing in them. So what the heck do we think this same stress that me and you have, maybe in different ways in our kids, from birth onward, how is that affecting them? I mean, really, we just have to sit and think about this logically. You don't even have to know the science, which the science is there. But like, what's that doing to these kids? Right? It's devastating their health, really, is what it's doing. So there's often the sequence of things that have occurred. You can plug you or your little one into this equation that we've kind of been talking about, this algorithm, and see how your story, maybe their story, fits into all of these previous slides. Okay, so that's kind of the point. Like I said, looking at this from two lenses. Okay, with just a few minutes left today, so let's go over this. Let me do this last thing, because I kind of hit this last week, I think it was, birth trauma. Because birth trauma, I mentioned on that second slide, forceps, vacuum, C-sections, etc. But labor and delivery for both the mother and baby can be traumatic. Obviously, it's men don't give birth to babies for a reason. God knew what he was doing, man. We're wusses compared to y'all. I mean, that's just plain and simple. Let me tangent. Okay, when I did a lot of physical medicine, so chiropractic, and then I did a lot of muscle, soft tissue work, and rehab and stuff like this. I'm not kidding you. The biggest, most toughest, masculine guys were the biggest wimps. I'm not even kidding. They're just the biggest wimps. So, ladies, all ladies in here today, y'all got it going on. You guys are so much tougher than us. So anyway, but it still can be traumatic. Okay, so we've widely accepted too many routine procedures. These routine procedures that have become normalized in our culture, that are causing a massive amount of stress in our babies. Okay, and this is documented. This is evident. There's evidence for all this. So maybe it's a longer labor and delivery. Okay, the more interventions there are, like I said earlier, even the epidurals. And again, I would never shame someone for having an epidural. Like, I would probably beg for 5 of them if I was giving birth, like literally. But like, what are we doing? What part of the point here is, if interventions are needed or necessary or even wanted, right? I'm not here to shame or guilt. Like, what's being done to evaluate this baby, to care for it, because these things did happen? That's the missing part. That's the gap in traditional care. Nobody's assessing the babies. Are they in fight or flight because of these interventions or because of the stress or whatever happened? Okay. Does that make sense to everybody? We need to assess these little babies better than we are. Okay. But on the other end, I was an example of this. I was number 4. I was the kid number 4. My mom and dad lived in Seward, Nebraska at the time. They were 2 blocks away from the hospital. My mom woke up at like 1:55 in the morning, and I was born at 2:09 in the hospital. It was fast. And guess what? A fast delivery is actually can be traumatic on a baby as well. And you know what happened to me? I had a version of a sensory processing issue, okay, that I didn't know about until I was like 32 years old, when I started to like know all of this stuff, get educated. Okay. And it probably started back with the birthing process for me. Okay. So forceps, vacuums, emergency or scheduled C-sections are associated with poor outcomes of things we'll talk about today. Again, there's no shame and guilt in all of this. Sometimes C-sections are necessary. Maybe a mom chooses to do that. I mean, I've worked with people on all the whole spectrum, but it's just like the knowledge of like, if that does happen, or if someone does choose to do that, like, what do we need to look at? Okay. That's the point, because what this nervous system dysregulation really is, this fight or flight kind of born into, it's actually, there's a diagnosis term for it. It's called dysautonomia. So dysfunction of the autonomic nervous system. The autonomic nervous system is your fight or flight, rest, digest. Okay. And if this is happening preconception, during pregnancy, and then obviously at birth, which it is in so many of our little ones, this directly impacts, you guys all know this word, the vagus nerve, greatly. The vagus nerve is responsible for so much: heart rate, breathing, digestion, the immune system, and it actually is a huge part of social and emotional regulation. So if you're thinking, if someone's trying to argue or debate me on, behavioral issues in a kid have nothing to do with their gut, I mean, you're wrong, because that's where all the evidence is, and more every single day. Okay. I don't tell people that like that, I can debate nicely, by the way. So anyway, the vagus nerve is like the moonwalking bear. It's like dysfunction in that vagal nerve. It's the thing that we're not looking for. It's the thing we're not evaluating. One of the things. Okay. And this is that term I said earlier, is they'll grow out of it. Don't worry, they'll grow out of it. They'll sleep eventually. They'll eat eventually. They'll get over this ear infection eventually, blah, 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 all the things. Okay. So reframing how we think about these things. Are they growing out of it, or are they growing into the next stage? Is everybody connecting with that? If you don't remember anything else, remember that. Are kids growing out of things, or are they just adapting and growing into the next step, which is leading them down a path of chronic illness, or fill in the blank, whatever you want? Okay. 116. I got to stop there. Next week, we're going to continue the birth trauma. There's some specific things with that I want to show you guys. Now, if you're, I'll just give you a forewarning now, but I mean, please come next week. You don't have to watch it, but I have a video of a C-section that I think is going to blow a lot of your minds. And it's a routine C-section, and how that one procedure, and again, you can put forceps and vacuums and a cord wrapped baby, which is, some of this stuff is unpreventable. Like if there's a cord wrap in a baby, or they come out breech, I think Janine asked that last time, like all of these things can potentially cause kind of this systemic nervous system dysautonomia from the day that they're born, potentially even before that. And so we're going to dive into even more detail of that next time. I'm going to show you guys, I mean, I think it's cool. I hope you guys think it's cool, like the neurology of it, right? So like actually like, okay, why does a baby that's being pulled out by their head, why does that impact the nervous system? How does that impact the nervous system? And what does that part of the nervous system like link to and relate to in our bodies? That's what I'm going to go over next week. So I hope you all can join me. Is next week Thanksgiving? Yeah, we're still going to have the Wednesday call. Okay, so I hope everybody's able to get on next Wednesday. I'm pretty passionate about this subject, as you guys can tell. So anyway, that'll do it for today. Anybody have any questions? If you need to go, you can go, but I'm happy to stick around. I do not have to leave right away. So any questions, comments, concerns before we log off?
Thank you.
Yeah, did you get something from that? Did you learn something? Enjoy?
Yep.
Okay, good.
So-
Good,
yeah.
good.
That explains a lot of my childhood.
That's it? Yeah.
I know mine too. And then Emily has asthma, and I was induced, so
Okay.
it probably all started.
Yeah, and again, here, I don't know who already logged off, but maybe it was Stacy. I don't remember, but no, Stacy's still here. Somebody did. sometimes I think of things like, I got to be careful how I word things sometimes. And it kind of goes back to like the causation versus correlation whole thing is, and I would never want someone to leave a talk like this and be like, okay, oh my gosh, my mom had a C-section by her choice, and that's why I am the way I am. Like it's a lot, it can be a lot more complicated than that. There's no shame, there's no,
Yeah.
because being induced or having some sort of birth trauma, whether it was voluntary or not, or emergency, that was setting you up.
Mhm.
It kind of so there's so many other pieces of the puzzle, like if you were a baby of traditional medicine, which I was, right? Then there's just little things that happen over time, like
Yeah.
medications, antibiotics, vaccinations, all of these things, the food, the formulas maybe that we were given because my mom couldn't breastfeed. I mean, whatever. There's so many pieces to the puzzle. Okay, so I never want anybody to think it's like one thing. It's the whole accumulation, the cumulative effect of the three T's. So again, remember those three T's: the emotional part, the physical part, and the chemical part. That all have a role. So,
Yeah, I shouldn't have said it like that. Sorry.
oh no,
But
no,
I
no,
was
you
just
didn't say
thinking
it
I
like
was
anything. I just
induced
wanted
and
to.
then okay.
I just feel like sometimes I say things and they're perceived one way. So just to make, I
Oh,
just wanted
yeah,
to make sure it
no.
was clear. Yeah.
Okay, no, I just said it completely wrong. I don't think that's why she has asthma, but it just all correlates. So,
Yeah, yeah. It well, yeah, and we that's exactly why I wanted to present this is like just the little check boxes. You don't have to, and
Mhm.
somebody doesn't have to check every one of them, right? So everybody has a unique story. So, any other questions or comments?
Nope, thank you again.
Okay, yeah, and like I said, guys, this is going to be one of those talks that I'll just encourage you. You never have to do anything, but like when I send it out tomorrow, and you guys get the YouTube link, and send it to people. Like send this talk to people, and part two will be next week, which is going to be, I think, even better, because it just really brings all of this home. Like everything we talked about kind of right now is like theory and like, okay, but how does it actually connect and make sense? And we're going to put all those pieces together next week. Okay.
Okay.
All right, y'all. Have a wonderful rest of your day and week.
Okay. Thank you.
Bye.
Yeah.
See you. Bye-bye.
Bye.